thinking back over the 15 years, really looking at the growth that has taken place with the Department of Mental Health has been extremely huge. I think that the fact that now we're in a position here in the state of Oklahoma where anyone that's dealing with a psychiatric emergency or in a situation where they need help now can call one number, one line, 3 digits, 988. And I hope people remember that number, because anytime you're in a situation where you want help for a loved one, a friend, or family, to be able to call that number and get help immediately is critical. And so I when I think back over the years, I came into the system, and of course, when I started, I was a therapeutic foster mom, really working, really living my life in a way where I was giving back to kids who didn't have parents at the time. So I came in the system as a therapeutic foster mom, and definitely a challenge. So I can understand parents today, or foster parents today, who are dealing with kids who have problematic behaviors. And so as a foster parent, coming into the system and looking at the system from the lens of a parent was really important for me, and has been extremely important as my career, because I've really worked to build a system for children, youth, and families, for parents, for caregivers, so that, parents and caregivers can get the help that they need, and get the help that they need now. And I think, thinking back in our design is kind of like, as a parent, if I wanted help now and I needed a medical help, I can go to an emergency room and feel like I can get the help that I want. And so I wanted a system where when parents had psychiatric emergencies for their kids, they can get the help that they needed now. And so the department, we started our building our continuum of care, really looking at kids that were kids that were higher needs, kids that were at risk for out-of-home placement, kids that were at risk for being hospitalized. And so we built a system called a system of care in order to support those children and families anywhere in the state of Oklahoma. We started with two county sites, a rural and a metro site, really building services and supports for families that were high need. That spread like wildfire, and we were able to get support from our legislator in order to expand that statewide. So currently, right now, we have a systems of care in place that provides wraparound services. And the wraparound is just like it says, they wrap services around children and families in order to support the psychiatric needs that these kids have. And so building that platform where we have the availability of these services supports statewide was extremely important. As we navigated through that, different initiatives came along, and of course, like you said, different funding, which allowed us to build additional supports like peer supports. Peer supports are services that speak to the caregiver and the parent in a way when they're going through different challenges. They have somebody who has had those types of experience and can speak to that. And I think those are extremely important, because there's nothing like being in a situation where you don't have the resources, the support that you need in order to address an issue that's really going on with your young person or your child or your kid. And so building a peer support system was also extremely important. We continue to leverage different funding opportunities in order to build services for kids that were ages 0 to 5, which is our early infant mental health services. We were able to build services for kids we consider to be SED, severely emotionally disturbed. Services for kids that were 16 to 25 that were, maybe had diagnosable mental illness, that was having challenges with transitioning in life and transitioning to adulthood. We were fortunate to build services that supports not only schools, but kids that were having problems in school systems, as well as really leveraging opportunities to partner with agencies like the Office of Juvenile Affairs and the Department of the Department of Human Services. What we know is kids that are young people who are involved in both of those systems have much higher challenges than the average or the overall population. So building partnerships that created opportunities for those young people to receive services and support that they needed to meet the needs that they have. So we really worked extremely hard to build a service system here in the state of Oklahoma that would meet the needs of children, youth, and families. And probably about 3 ago is really when we launched and when we had an opportunity to really design and develop and move forward with the implementation plan for our children's mobile response and stabilization. And so that was an extremely important partnership with other agencies, child serving agencies here in the state, to really look at what did that system need to look like for the state of Oklahoma. Ultimately, our vision was that any child in the state of Oklahoma would have access to an immediate face-to-face response from a mental health professional who is able to work with the child and the family in order to begin and move in a direction to address their behavioral health needs, to begin to dissolve or decrease the symptoms of the crisis in order to move the family in a position of stability and stabilization. So that's kind of how this all started. And so this was not something that we started a couple of years ago. This has been a journey that we've been on. And I think our vision was on the end result. We want to be able to meet the needs of Oklahomans. We want to be able to, first and foremost, a crisis system is designed to save lives. And so that was really an important part. But we needed the support system, the foundation in place to be able to do that. And so today, we're in a critical, unique, and probably the best thing that has happened in a long time is this 988. Now they don't have to remember a 1-800 number. Now it doesn't matter if your young person is living with grandma and grandpa, or if they're staying with Aunt Mary down the street, or they're way, of course it takes about 4 hours to drive across the state of Oklahoma, unlike some of these small states. But if they're in a family member's house, we will all know the number, 988.